Pilates to ensure the maximum benefits from your workout. When lying on your back, there are two different spinal positions that we use for specific exercises. The first is called neutral spine. This is when there is a small natural arch underneath the lower back with the tailbone down on the floor. Do not increase this natural arch as this is incorrect. The second spinal position is called imprinted spine. This is when the pelvis tilts slightly and the lower back draws down towards the mat. Make sure you don't tilt the pelvis too far, otherwise the tailbone lifts off the floor and this is also incorrect. The most important muscles used in Pilates are the deep lower abdominals and the pelvic floor. These muscles support the lower back and also flatten the stomach. We refer to these muscles as your T-zone. Now to T-zone or tighten these muscles, imagine that you have a letter T drawn on your stomach. The horizontal line of the T coming across in between your hip bones and the vertical line of the T coming up from your pubic bone. Now if you place your fingers just inside your hip bones, this is where you will feel the T-zone working. Make sure the spine is in neutral position and think firstly about drawing up your pelvic floor muscles along that vertical line of the T as though you were trying to stop from going to the toilet. Once you've got those pelvic floor muscles tight, keep them tight and then think about the horizontal line of the T. Try to flatten that line down towards the spine as far as you can. You may actually feel the muscles tighten slightly underneath your fingers. The T-zone is different from imprinting your spine. The T-zone should be tight in every exercise you do and should be on in both the imprinted and neutral spine positions. Take a little time to practice your T-zone as it is vital in achieving results from your workouts. The breathing patterns will be given with each exercise. Pilates breathing is in through the nose and sighing out through the mouth. You need to make sure that you direct your breaths into the upper chest and rib cage area away from the stomach so that you can actually keep your T-zone and abdominal muscles tight whilst breathing at the same time. An incorrect breathing pattern is when the stomach expands and rises rather than the chest and ribs expanding. Remember, work within your own limits and please rest if you need to. Some exercises will have different levels. Tanya will be demonstrating the easier levels and Jade the more advanced versions. You should feel no pain in the neck, back or other joints. If you feel pain in your back, check your technique, choose the easier version of the exercise or simply skip that exercise until you get stronger. If you feel any of the abdominal exercises straining your neck, again check your technique or you can simply place your hand behind your head for support or keep your head on a pillow on the floor. Make sure your shoulders are relaxed and not hunched. To do this, make sure your shoulder blades are drawn down and back towards